My name's Karen Sanders and I'm the Trial Manager at the MRC CTU for the STAMPEDE trial. In this presentation, I'm going to talk about treatment failures in STAMPEDE patients, about the way that these can be detected and how they should be reported. So firstly, the appearance of new lesions will be defined as a failure event, and this would need to be confirmed by CT scan. An increase in the size of the baseline lesions would also constitute a failure event, and once again this would need to be confirmed by CT scan. A biochemical progression is also classed as a failure event, and I'll discuss this in a little bit more detail in a moment. And finally, death from prostate cancer would be viewed as a treatment failure. So in order to understand when to report a biochemical progression, i.e. a PSA failure, we firstly need to define a couple of terms. So first of all, the PSA nadir. This is the lowest reported PSA level between randomisation and week 24. The PSA value that would then constitute a failure depends on both the baseline PSA and the PSA nadir. And there are three possible PSA failure groups, A, B and C. The graph shown here demonstrates each of the three groups of PSA failure. The values along the x-axis represent the patient's baseline PSA, and the values on the y-axis represent a patient's PSA nadir. Firstly, Group A. These are patients for whom the PSA nadir never falls below 50% of the baseline value. Then Group B. These are patients whose baseline PSA does fall below 50% of the baseline but remains above 4 nanograms per ml. And finally Group C, the group into which most of the patients in STAMPEDE will fall. And these are patients whose PSA does go below 50% of the baseline and also does go below the 4 nanograms per ml. So having separated patients into groups, we must then determine how to define when a patient has failed. For patients in Group A, they are said to have failed at time 0. For patients in Group B, they are said to have failed when their PSA increases by 50% above the nadir. And for patients in Group C, they are said to have failed when their PSA increases by 50% above the nadir or goes above 4 nanograms per ml, whichever of those is greater. So to summarise, once we've received all the PSA values recorded for a patient within the first 24 weeks post-randomisation, we will issue a letter to the investigator detailing the PSA nadir and PSA failure value for that patient. Before a PSA failure is confirmed and reported on the progression form as an event, it must be confirmed by 2 separate readings. So that concludes a summary of information about identifying treatment failures in STAMPEDE patients. If you have any queries or would like any further information, then please do not hesitate to contact us at the MRC CTU.